And we are about to move into our next session, but I just wanted to chat with you a little bit about, well, of course, the election. I don't think we can not talk about that. I woke up yesterday morning and there was a rainbow over English Bay, and it's so beautiful, everything you were talking about, the rainbow being the stairs to heaven. And I thought for sure it was a sign. Hills, that's what I call her because we're good friends in my head. I thought Hills is going to win. What a triumph for women. What a great way to start a summit on stigma. And then last night we watched the results come in, and finally Trump's win. And I went quiet. I got a little pensive at the event that I was hosting. And I'm pretty good at rationalizing things. My friends will tell you that I can rationalize most anything. So I started to think about what this meant and what it would mean for our work moving forward in this great North American continent. And I thought, well, perhaps I should not have been surprised, despite my optimism. I should not have been surprised that angry, older, cis, white people are resisting progress. And that this was a reminder that the work that we're going to talk about in this summit over the next couple of days is directly related to that. And that, in fact, even in our progressive, human rights, loving Western nations, the silent majority still do control our world. And I know some will say, well, that's America and things are different here. But we know that isn't the case. Racism, transphobia, HIV discrimination are alive and well in our country and maybe even in this room. We only need to look at data on things like HIV disclosure and criminalization to know that even queer men believe that the Supreme Court is correct and that we should punish those who don't disclose. An unpopular idea in this room, but very popular in some of our own communities. Or how about the subtle or even overt racism and body shaming that we see on dating apps and hookup apps, or the significant amount of transphobia demonstrated every time we change a bathroom sign or try to give trans people access to care. But it isn't all bad news. We know that some gay men have seen their lives dramatically improve in the last 30 years. We know that our funders, researchers, and policymakers are starting to prioritize our health. This summit is a great example of that. This year, now in our 11th year, this year's summit registration is our largest ever with over 250 registrants, so thank you. We had an overwhelming response to our call for submissions, so many that we plan to move the deadline next year to give the planning committee more time to make room for everyone. Hence the reason there are so many breakouts, and I've heard the message loud and clear. You guys like choice, but not that much choice. So we're trying to figure out how we can wrap our head around that a little bit. Please, in the evaluation sessions, in the evaluation afterwards, I encourage you to give us some suggestions on how we might better accommodate all of the great things that are coming out. We were debating about adding an extra day perhaps next year or changing venues, so we're really open to that. But we're also appreciative, I think, having such a robust and so many people submitting and wanting to be involved really speaks to where we're at. So I want to recognize the privilege that we have to be able to spend 2 days talking about how we're going to resist stigma. So let's use this time wisely. To do so, I'd like to recommend perhaps a collective trigger warning. I think that there are going to be some presentations over the next couple of days that will trigger people, and I think that that's a good thing. Let us challenge each other but not attack. Let's try to call in rather than call out. Let's recognize that regardless of pace, because we know that we are all moving at a different pace, let's try to remember that we're still here because we care about the health and well-being of gay, bi, two-spirit, and other men who have sex with men, including trans men. And let's thank the goddess we don't live in America. Quickly, I want to acknowledge some of the people that have made the summit possible. Our collaborating summit partners include the Health Initiative for Men, the BC Centre for Disease Control, and YouthCo. Our funders include the Public Health Agency of Canada, the Province of BC, and the BC Ministry of Health. We have some corporate sponsors this year. Gilead and Merck have come on board. We're grateful for that. Our planning team, Moffat Clark, Joshua Edward, Rob Higgins, Darren Ho, Terry Trussler. And I wanted to also make a personal thank you to some people that I've been consulting throughout the process, so Sarah Chown, Nathan Lachowski, and Michael Quagg. And we want to thank Katie for their ongoing support, and of course all of you for coming. So welcome to the 11th Annual Gay Men's Health Summit.